I recently created a LLC called Sarva Health Systems, and with my husband and also with one of my teachers in Charlotte. And Sarva is that a Sanskrit word that means everything, and it means everything in a really beautiful way, like a sense of permeating or a sense of encompassing or enveloping. So Sarva Health Systems, we decided that we wanted to create an organization that would be able to train yoga teachers as well as various health professions in how to use these technologies of yoga in their professions. So mental and behavioral health practitioners, nurses, physical therapists, occupational therapists, teachers, parents. You know, we wanted to be able to help people to understand how to, and also companies and organizations, to be able to understand how to use these technologies. And at the same time, as someone who trains yoga teachers, I feel that it is my responsibility to develop the market for those teachers, to develop so that there's places for them to actually go out and teach beyond yoga studios or gyms. We have a very big vision. I mean, we really see yoga as a way to shift the public health. And we have evidence base now, you know, we have research behind it. We are starting to find different ways to deliver this. It's cost effective, it's affordable, there's efficacy. I mean, there's all these it has all these things going for it. The one thing that research really demonstrates is that people are much more likely to be compliant to actually do the stuff if they're in a community, as opposed to just saying, here, go do this at home. Some people will do it at home, but a lot of people won't. And so having places like community yoga really create the opportunity for people to really implement those changes in their life and ultimately in their health, and that starts to shift. I see it all the time, how people tell me they did something and now it's starting to shift the way their family's thinking. It starts to shift the way their friends thinking. The rippling effect of it it's amazing, and we can't ignore the power of that. Part of my big mission is to help yoga to expand beyond the confines of the fitness industry out into other areas of health and human services, so that we're delivering yoga to a much broader stroke of the population. You know, we live in Asheville, so you think like, oh, everybody does yoga, but it's not the case. At the last big survey that was done, it was only, I think, 17 million people that were practicing yoga, which really isn't that much when you think about 300 million people in the country, you know. And I'm very interested in these underserved populations, like the African American communities and the Hispanic communities, the underprivileged youth, at-risk youth. And I'm also very interested in yoga as a preventative health strategy. Prenatal yoga is really important. That the health of the child in the womb is a huge indicator. These indicators are huge about what the health of that child is going to be in 20 years' time, 30 years' time. I mean, there's incredible research on that right now. So what that tells me, that if we are able to affect that population of women having babies, that we can change that, we can start to change the direction of health of the future populations too.